Hey, everybody, it's Jessica DeMassa with What's the Future Health? We are talking to the who's who of health technology and healthcare innovation. And today we are demanding excellence, centers of excellence for all self-insured employers and a new way to access the care that they can deliver. So please welcome my guest. This is Sach Jain. He is the founder and CEO of Carrum Health. They've just closed a $40 million Series A round. Tiger Global Management led that. So we are going to find out exactly how he's trying to disrupt the model for how employers access care from centers of excellence. So Sach, it's great to have you with me today.
Thank you for having me here.
All right, so jump right in and explain the business model. Let's just start there because it was a lot more than what I expected it to be. So I read it described as a digital marketplace for employers where they can, access care from centers of excellence. But say more about that. Tell us how it all works.
Yeah. So what we have done at Carrum Health, we have built what we call industry's first digital healthcare marketplace that connects self-insured employers directly with top providers in the region across the nation using standardized surgical episodes. In the process, we enable these employers and their employees to purchase these surgical episodes directly from top providers for one single price. So by doing so, we take out all the confusion that otherwise exists in our healthcare system today, where a member has to think about copay, coinsurance, deductible, and all that confusion is gone. And a member now can get a surgical episode done with complete peace of mind. The way we go about doing it is for the specific surgical episodes that we focus on, we identify who are absolutely the best hospitals, ASCs, and surgeons that deliver excellent care for those kind of episodes. We bring them on our platform using our standardized bundle payment definitions, where everything is covered for one single price, including a readmission warranty that comes with every bundle that we offer. And then we connect these top providers directly with these self-insured employers. And if an employer decides to adopt, they have access to the Centers of Excellence platform almost in a plug-and-play fashion.
Okay, so I want to come back to this warranty thing in a minute. So do not think that you are getting away with that. But I want to talk more specifically about what these surgical episodes are. So can you give us a sense, is this like a knee replacement, hip replacement, like the most serious of the serious, the most costly of the costly? Give us a sense of what types of surgical episodes someone can buy from you. And it sounds to me almost like it's like buying a car. It's like the whole package is bundled with a total. Is it like that?
That is exactly right. And the challenge with our current healthcare system, especially in the PPO world or fee-for-service world, is that we pay for healthcare like we are buying a car part by part. Everyone is busy, to your point, billing for all different parts of the car, the doors, the mufflers, the wheels. No one is worried about whether the car actually works and the driver has a good experience.
And everybody knows how much it costs.
Exactly. You're going to the dealership and you have no idea how much you'll end up paying. And so the journey that we have taken at Carrum Health is to be able to bring that whole car purchasing experience through our platform. And this car comes with a warranty. So everything that is involved in a surgical episode, whether it's pre-op, imaging, anesthesiologist fees, the surgeon fees, the facility fees, all 1,000 things that you receive bills for, all of that is covered for one single price. And it also comes with a warranty, which you were asking for earlier.
Yes, I want to hear about this warranty. So before let me ask one quick thing. So it's all one price, and people know what the price is before they book the surgery. Yes.
Absolutely.
Okay.
So, given we work with employers, employers know beforehand what exactly, for a hip replacement bundle at Stanford Healthcare, how much will it cost if I send one of my employees to get the procedure done over there. And from an employee standpoint, it's even simpler. their bill is zero.
That's amazing. All right, and
They
tell me about this warranty then. So, like, what happens? Like, how does this work? That blew my mind. I was like, wow. And I want to wrap this into a conversation about your provider network, because you're kind of putting them through the ringer there. But explain the warranty piece of this. I love that.
Absolutely. So currently, what happens in the our PPO world and the fee-for-service world, if you go for a surgical episode, if it goes well, that's great. You're fortunate, and nothing happens. But many times there is a complication, there is a readmission, and you have to go back to the hospital to get that fixed. And so hospital actually makes more money in that scenario. It's not providers intentionally do that, that's not the case, but the incentives are not correct to make sure that the surgery goes correct very first time. So in our model, because we are not only picking providers that deliver excellent quality of care, we're also making them accountable for that care through this warranty. So what it is that within a certain period of time, let's say 30 days, if there is any complication or readmission that is related to that procedure, provider will have to cover that free of charge. And it immediately aligns their incentives, so they make sure that the outcomes are great. If not, they actually lose money on these contracts.
I love it. This is value-based care at its finest.
Value-based care,
it is.
Exactly.
All right, so let's talk about that provider network, because I'm curious to know how you've talked them into participating. Because in addition to the 30-day warranty, standing behind the surgery that they've performed, these centers of excellence have to undergo a 50-point proprietary inspection. And it's not just the COE. I read it was also the surgeons as well. So how are you convincing, first of all, how many providers do you have within the Carrum Health platform? And how have you convinced them to partner with you? Because this is pretty tough. Why wouldn't you just stick with the way the regular insurance companies do it?
Exactly. And, just starting with how many providers we have today, and there's a journey. When we were starting Carrum, and we will go and have a discussion with the provider about joining Carrum's platform, the knee-jerk reaction would be exactly what you described, like, hey, why should I be doing this?
Right.
And inherently in any marketplace, there's this chicken and egg problem where a provider you will go to, they will say, interesting, tell me, how many surgeries, how many employers you represent. And if you go to an employer, they will say, tell me about your provider network before I do anything about it. So the journey of Carrum Health over the last 6-7 years is also about how do we get around the chicken and egg problem to scale the model. And today, we reach a major milestone in 2020 where majority of the US population lives within a drivable distance of one of our COE partners. And that obviously led to a lot of employers using Carrum, including several Fortune 100 and Fortune 500 companies. The reason providers are interested in Carrum model are primarily for two reasons. One is, in our current fee-for-service model, it takes provider a long time to collect all the bills. They have to chase health plans, they have to chase patients. And as high deductible health plans are becoming more and more prevalent, chasing patient becomes even more important, and which is also a very costly exercise. And many times they are not even able to collect any bill either from the health plan or the patient. In our model, the provider payment is guaranteed, and it comes immediately after the discharge, which is unheard of.
That is.
Like hospital CFO, they hear that and they're like, "Oh my God,
that's awesome.
This is unbelievable." So all their, metrics like account receivable, bad debt collection, all of them, look great. The second reason is that by joining Carrum platform, providers have access to an increase in their volume. Especially surgical episode, they are the lifeblood of any facility, any health system out there, because they have the highest contribution margin. So from a provider standpoint, any incremental increase in the surgical, transactions is very lucrative. And Carrum enables that by giving them a direct line to these very large and aggregated set of employers that are choosing those providers to work with through Carrum.
That's amazing. I love the payment model disruption. Like I always feel like that's like if you can do that too, it's like that really does create that wow moment, that wow factor. All right. So speaking of those large self-insured employers, I wanted to ask you another thing that caught my eye was about your model was the data that you're collecting on patients going through with these surgical procedures, how the centers of excellence are performing, the costs related to all of this. You've got a nice little data lake that you're swimming in there. So what kinds of things have you been learning that you can share with us? Maybe give us a little bit of insight, or what are some of the things that maybe HR benefits administrators ask you before they sign on to the platform about some of the data and the insights you've gleaned?
Absolutely. And the beauty of a solution like Carrum is that the value is very apparent. It's not a wellness solution that will deliver a value in 3 years. Once all the employees are healthier, it is very black and white that an employer have access to the claims data, for example, and through the claims data, you can easily estimate how much they are paying for these specific kind of procedures and what is the prevalence of these procedures in the given population. And after implementing Carrum, two things happen. One, because we are picking providers who do surgeries when they are necessary, the prevalence of those procedures go down significantly. So almost a quarter of the surgeries that come to our platform gets avoided because after going through the process, it's determined that surgery is not the right course of action, which is a great outcome for an employee who did not get a surgery when they didn't need one. And it's a great outcome for the employer because they didn't have to spend that much money on that unnecessary surgery. The second part of the data is that we show to an employer in a very black and white fashion before Carrum how much they were paying on an average for these procedures. And when they implemented Carrum with our rates, that percentage comes down very, very significantly. So we have done pretty deep studies to demonstrate the impact, and on a unit cost basis, the savings are anywhere from 30 to 40%. So
30 to 40% about from what they were paying before.
Exactly. So you combine the appropriateness of care, which is reducing unnecessary procedures, plus unit cost reduction, and you're talking about almost 50% reduction in the overall span on those kind of surgical procedures, which is, and it is immediate. It comes to you right away, not next year, not the following year.
All right, I was going to ask you, how much cost is there to remove where you can take it down so far that the employer sees a benefit, but you guys also get paid? So good. Exactly. Thank you for answering that. I want to jump back real quick to the unnecessary versus necessary. And this was a question I had when I was reading through about with your fundraise, the 40 million, one of the things you guys are going to do is obviously invest to grow the business. Any eye on that space that's currently owned, the second opinion space? So preventing the unnecessary in the first place. So Grand Rounds, obviously very successful in that space. We just saw Second MD get acquired by Accolade for $460-something million. So any interest in going in that direction for you guys?
Well, in some ways, it is already baked in our model. So
you're already there.
Every surgery or any case that comes to us has to go through a second opinion process, what we call an assessment bundle. And someone comes to us with an existing recommendation for a spinal fusion surgery, for example. They go through the process and our COE surgeons evaluate the case and they make the determination whether they go ahead with the original recommendation, or they actually advise the member that there are better options than surgery. So it is already in some ways baked into our model. And, we have a lot of respect for our peers in the second opinion space, what they have done. And, there is value to having a broad second opinion piece where, they are covering perhaps the entire gamut of healthcare when we are focused specifically on, a surgical intervention when the member gets there.
So I saw the market opportunity was kind of categorized as like $100 billion market opportunity. Who else is swimming in this space then with you? Like, who do you consider to be your biggest competitors?
Yeah, I mean, look, the space has been around for over a decade. And there are the initial set of players that came into the space were sort of in three flavors. One were, health plans, trying to do it by themselves. And, that offering didn't take off because it just didn't have the teeth of better savings and better outcomes. The second set of players were where employers were trying to do it by themselves. So, a Walmart is a great example, and they set up a COE platform, which is really well done, and they're very happy with it. And we had a lot of learnings to do from some of these pioneering employers. But Walmart is a different beast, right?
Yes.
They can do things that most employers cannot. So even one of our existing employers, which is one of the top airlines in US, they had their own COE program, and then they realized that these programs are just very difficult to run and scale because you are essentially creating an entirely new solution with a very resource-strapped benefits team.
Yep.
So they liked the program, but they wanted someone else to do it better and deal with it. So they came on Carrum's platform, and they are one of our big customers. And the third set of players are the initial set of companies that saw the opportunity in more like in a domestic medical tourism kind of setup, where the model was member will fly from all over the place. Cost was primary focus, not quality. What Carrum Health has done, it has taken a bit of a ground-up approach to build out this model using technology and making it very, very regional, so that a member who are looking for an intervention for a procedure like this, they are able to drive to one of the COEs as opposed to getting on the flight.
All right, it made you talk a lot about the business, so hit me with some more of this patient experience member talk. What are the highlights there?
Yeah, I mean, look, my journey in healthcare started with experiencing how bad the patient experience is.
You're not alone.
I'm not alone. I took an operating role with of all places, a hospital revenue cycle management company in Chicago. And if you talk about the dark corners of healthcare, that is probably as dark as it gets. These are the companies that hospitals hire to maximize their reimbursement against health plans, against patients. And I saw firsthand, just on daily basis, the stories of patients receiving medical bill when they thought they have a nice insurance, but somehow magically anesthesiologist was out of network, or receiving $1,000 bill for removing simple stitches. And they happen every day. And I felt that there had to be a better way where patients could actually focus on getting healthier as opposed to fighting the healthcare system when they're going through an acute care episode. So in our model, the patient experience is really transformed. One, there is no financial uncertainty. If you are using Carrum, most likely your out-of-pocket expense is zero. So employers cover everything. And you don't have to worry about any surprise bill showing up your way, or 3 months later, the bills are still settling. None of that happens. And if you are going through a surgical episode, typically it's an event that is life-changing, right? It has an impact on your life, and you want to make sure the surgeon, the facility are the best in class, and you are getting the surgery only when it is necessary. Just given the process Carrum goes through, you mentioned this 50-point, algorithm that we use to identify who are the best providers and surgeons. We make sure any surgeon that is touching Carrum patients are the best of the best. If you're working with Johns Hopkins, even in Johns Hopkins, we are picking the best of the best surgeons over there to touch Carrum patients. So quality is reassured by all different means. And plus, we give an app to a member that manages the entire surgical episode for the member, and everything is virtualized. So from form filling to second opinion to medical record collection to post-discharge care coordination, everything is done through the app. The only thing a member needs to do is to show up at the hospital or the ASC with Carrum card, and that is also embedded in the app. So in
That's
today's
cool.
time, when no one wants to spend an extra minute in doctor's office or in the hospital setting, this is perhaps as good as it gets. So the patient experience is transformed. Our NPS score is above 95.
Hey, we like to hear that. That's great for a healthcare company. They're usually at the bottom.
It's only 120 points higher than where the current patient experience is.
Yeah, right. No, I mean, yeah, we're all familiar with that. But I think, I mean, more than anything, I think you hit the nail on the head. It's just if you're having a surgery, it is a big event. And to have all of those administrative details, including the sticker shock that usually comes after it, eliminated from the patient experience, I mean, that's pretty compelling right there. So that's very exciting to hear. No wonder that Net Promoter Score is so high.
I mean, patients love it. We have patients who are sending us gift cards.
You don't often hear that. It's like you're paying your healthcare. Let me give you something extra. What? All right, so Sach, let's close this out. Let me hear what you guys are planning for what's next. Because obviously, I mean, I think anybody who's listening to this, who's got like value-based care blood flowing through their veins is like, oh, this is it. So, I mean, tell me what do you think is up ahead for us? Like, what is your thesis, and how do you see kind of the transformation of healthcare moving forward and your role in terms of engaging large self-insured employers who are usually more innovative than any other, healthcare buyer out there. Tell us what you think is coming next.
Sure. Our thesis is that that we are in the first decade of this transition happening from fee-for-service to value-based care. It is currently happening on a small scale,
Yep.
Here and there. And, it's very akin to any other industry, like take example of retail, right? E-commerce came in 90s and still, it's 2-3 decades in making, and still things are moving away from, brick and mortar retail business to e-commerce. So we see the world from the same lens, how this transition is happening in healthcare. And the value-based care has been a big buzzword, for the last decade. And it's, we at Carrum Health, we showed that value-based care really works if, it's applied in a very thoughtful fashion by bringing all different ecosystem partners to work together. And so we showed that, in our, first version of Carrum, where we brought hip and knee replacement, spinal fusion kind of bundles on our platform. And that led to lower cost, better outcomes, better experience. And, it's like selling books in 90s on e-commerce, right? And if it works for that, use case, you can continue to expand that. So over the next few years, we see that expansion happening in the product categories. We ourselves have, from joint and spines, we have moved away, and we are now offering hundreds of different bundles.
Awesome.
Across musculoskeletal, cardiac, and bariatrics service lines. And we'll be announcing some really new ones very shortly. And so, 10 years fast forward, I believe a good chunk of the span that happens in fee-for-service will move to value-based care. And, who knows, some Amazons will start emerging in our healthcare world.
They might just emerge themselves, so be careful. Thank you so much for stopping by to join us. It's a pleasure to hear about your business. I love walking through like novel models, and in this year of health tech, this past year, especially when so many companies were able to raise money and everything, it's good to see a nice big Series A go to something like this. So congratulations on that. And thank you again for stopping by.
Thank you for having me.
All right, everybody, that was Sach Jain. He is he's the founder, and CEO of Carrum Health. Be sure to take a look at everything they've got going on over there. I'm Jessica DeMassa. Thank you for joining us here on What's the Future Health. We'll see you guys real soon. Bye.